toxins in tobacco.
Interesting. Now, did you want to cover any other medications?
The last two are the pill medicines, and Zyban has been used for a long time, and Chantix, and they're highly successful as well.
Right. Now, are people using these very long-term, or is it kind of just to get them through a certain period and then they wean off
the recommended guidelines are about 2 to 3 months for most of the medications.
So that's pretty short term.
Pretty short term, and some people will need to use, maybe one a little bit longer than that on an emergency basis. But the vast majority of people, maybe 2 to 4 months.
Okay, that's I think a really important point, because I've heard people say, not want to trade off the cigarettes for the medication if they're going to be on that for a long time, but in fact that's not reality.
Well, there's some research that some clients need to use, to be on some of the products longer, and most of the experts would conclude that if you had to be on something like the nicotine gum for years, it's much, much safer than ever even having a single puff. Again, because it's just nicotine. Not 100% risk-free, but there's no carbon monoxide, no polonium, no cyanide, and the real toxins.
And we probably really won't even get to address all of those aspects of what's actually included in tobacco products, but I do want to touch on something you mentioned, which was the carbon monoxide. And I know you've brought an item here that you use in your treatment process.
Sure,
so let's talk about that.
The carbon monoxide screening is extremely important, and a lot of smokers don't identify a lot of the health problems, but a lot of smokers do get winded or short of breath, and it's directly caused by the carbon monoxide in the cigarettes. What happens is it binds onto the hemoglobin, and it blocks out the oxygen. So that contributes to more strain on the heart and lung problems. We like to use this not to scare people, but to motivate them that as they're quitting, as they're cutting down and then quitting, within 1 to 2 days of quitting, this clears out immediately. So as the breathing...
So they inhale this unit.
Each visit, each counseling visit, they blow in, and then right around their quit date, they'll see, as they're feeling better, as they're quitting, they'll see the objective evidence that, hey, the carbon monoxide is gone. And people love it. We use it in group meetings. They love beating the machine. It's a form of biofeedback.
Absolutely.
And it helps to kind of quantify the progress.
Yeah, I think it's so important for people to understand the really clinical aspects of what's happening when someone is smoking, and why it is so difficult to quit. And I think the average is how many attempts do you typically see?
On average about 8 to 11 times before permanent cessation. So a lot of people get down on themselves and criticize themselves, and we always say, well, you made it for a month, let's build on that. And that's pretty typical. That shows how addictive it is.
I think that's really important. You're right. People give up on themselves and think they just can't do it. But when you package it in a way, a little more of a clinical approach, I think it really helps to motivate and make it very tangible and doable for people. So when someone is coming into your program, what might be a typical process that they go through? So they're going through counseling. You mentioned group work.
Yes, we do a 45-minute detailed assessment, and we look at all the smoking patterns, and then at the end of that meeting, we come up with an individualized plan. So it's either, on average, about 6 meetings once a week. Some people do one-on-one meetings or group counseling, and then we use the medications as well.
That sounds very comprehensive. And quit centers are located throughout the state?
Right, we're part of a network of 7 quit centers throughout New Jersey, and we're partially funded with a grant through a comprehensive tobacco control program.
Okay, and that's a state-funded program?
Right, state-funded.
Great, okay. I'd like to talk more about that a little bit later, but one of the things we, I guess, always say, as difficult as it is to quit, though people can be successful and certainly are, better yet is to not start at all, right? And our next guest is Lauren Conley, who's with the Somerset Council on Alcoholism and Drug Dependency, and specifically, Lauren really focuses on prevention right up front to prevent youth from beginning. Thank you so much for joining us, Lauren. Can you tell us first a bit about the Somerset Council and what their goal is?
We're actually celebrating 35 years this year. And Somerset Council is a private nonprofit organization, and our mission is to prevent addiction, substance abuse, and related problems.
Okay.
And we do this by building healthy communities through life skills education. So
Great.
we
Okay.
have a lot of different programs. Some are evidence-based through the Center for Substance Abuse Prevention.
Okay.
And a lot of them really focus on crossing the lifespan. They're focused on different age groups.
Okay, great. And the center is also in other counties, right? Not yours specific,
Yes.
but there are similar organizations throughout the
The
state?
Somerset Council is part of the New Jersey Prevention Network.
Okay.
So there's an agency just like ours in all 21 counties.
Okay, great. And we certainly will have links to how someone can find out about that for both of your organizations. But tell us a little bit more about Rebel. I mean,
Okay.
Rebel is tobacco focused as opposed
Yes.
to other dependent issues?
Yes,
Okay.
Rebel stands for Reaching Everyone by Exposing Lies, and the
Okay.
lies are of the big tobacco companies.
Okay.
Rebel was created in 2000, and it was developed by and for teens to prevent and reduce tobacco use among teenagers and other members of the community.
Okay, great.
So-
And how long have you been in that role there, or how long has it been in Somerset County? That whole time,
It's been
or-
in Somerset County since the beginning,
Okay.
and I've been doing this for about 5 years now.
Excellent, excellent. Now, do you work through the school systems, or do you work, through other types of entities in the community?
In statewide, Rebel is in all 21 counties as well,
Okay.
and it's in the past few years become a school-based model. So
Okay.
in Somerset County, we have Rebel 2 we have Rebel in 10 high schools and Rebel 2 in 5 middle schools in Somerset County alone.
Okay. Now, is
So-
Rebel 2, does that just mean middle schools? Is that the difference in the
there is a
two?
difference in the
Okay.
program. Rebel is the high school, it's youth-led. They do a lot of peer-to-peer outreach and education,
Okay.
trying to influence their peers. And Rebel 2 is a curriculum-based program which the students in the middle schools really focus on outreaching to their 4th and 5th graders in their district, and they do outreaches with them, and they also do some peer-to-peer outreach.
Excellent. Now, my belief is, and maybe I'm not accurate in this, that smoking amongst youth has generally decreased over a period of many years. But can you share some statistics on what
Sure.
exactly it is right now?
Yeah, well, in New Jersey right now, there's 84.2% of teenagers do not smoke. And so a lot of the misconception is that, everybody smokes. But, there's been a lot of different avenues where it's helped smoking rates decline.
Okay.
And I think that with the Smoke-Free Air Act, with all of New Jersey going smoke-free, and Rebel, and there's so many different people trying to outreach about how harmful tobacco is. So I think that everything's affected the smoking rates. But, smoking rate, it shows that 90% of teenagers who smoke start before the age of 18. So that's why a program like Rebel and Rebel 2 are so important.
Absolutely. You have to prevent it while they're young.
Mm-hmm.
Right. And is it the general belief then that once someone, say, does hit 18 and they haven't smoked up until that point, chances are pretty slim that they're going to start afterwards?
Yeah, I mean, generally that's the idea.
So how are you getting the youth involved? When you're in the schools, how do you sort of convince them that this is an important thing and that this is a good
Well, really,
aspect to do?
because it's youth-led, the kids do all of that.
Do it themselves,
and really,
right.
they are the ones who influence their peers the most.
Right.
So when they're involved and they have fun and they're enjoying getting the word out, and they really believe in the mission
Right.
and the cause. So when their friends see how excited they are and how much fun they're having and how much they're educating their peers, they want to get involved too. So
Excellent.
being countywide, coordinated through the Somerset Council, I work with the advisors and the students in all of the schools.
Okay.
And so students can join that way and
Great.
really get involved.